Good morning, everyone. Welcome to today's webinar. For those of you who have just logged on, we have already completed a sound test, and thank you to everyone who helped out with that now this morning. Firstly, I just want to introduce ourselves. My name is Jennifer Patton, and I'm the HR consultant for Bright Contracts here at Thesaurus Software. And joining me today is Laura Murphy, who is the CHRO at Thesaurus Software and an additional point of contact for Bright Contracts. Please note that this webinar is being recorded and all attendees will receive an email later today with a link to the recording. So it's no problem at all if you need to pop off at any stage. If you do have any questions, you can type them into the question box on your control panel at the side of the screen, and we will get through as many questions as possible at the end of the webinar. Also, in the email, there will be a copy of the presentation slides that we are using today. So if there's any information that you wish to go back over, you can do so when you receive the email. So we're going to get started. So first up on the agenda for today, we have working from home new legislation. Next, we will be looking at the return to work safely protocol in relation to how to manage employees returning to the workplace. And then finally, we will look at the vaccine policy, which I know everyone is very eager to get onto, as it is incredibly topical at the moment with the vaccine rollout across Ireland. At the end of the webinar, as I mentioned, we will have a question and answer section where you can ask any questions about any of these topics or anything that we go through.
Perfect. Thanks very much, Jennifer, for the introduction. Good morning, everybody, and welcome to our webinar. And thank you all so much for giving up an hour of your time for the webinar. I hope you get something from it and you find it useful. But now that we've got all the housekeeping out of the way, we'll get to it. With working from home and the new legislation. So I guess it's over a year now that thousands of us packed up, left our offices and relocated to our home offices. But as the year went on, we began to see different trends, definitely from a HR perspective, in terms of working patterns. And I suppose one of the more worrying of those trends is the fact that whilst working from home did have its benefits and does have its benefits in terms of flexibility, it also has blurred the lines between the work and home life balance. And that's kind of backed up by a recent survey by LinkedIn, which says employees working from home are on average putting in an extra 38 hours work per month. So effectively an extra week's work in a month. Which is fairly significant extra hours. And the same survey also said that working from home has left employees feeling stressed out. And I guess with mental health being one of the key topics that's come out of the whole last year, this is something that needs to be taken seriously. And as employers, we need to be looking at that. But that leads us on then to the code of practice for employers and employees on the right to disconnect. So this is a government initiative as part of their strategy to ensure that remote working does become a permanent feature in the Irish workplace. So last year, the Department of Enterprise, Trade and Employment committed to introducing in the first quarter of this year a new code of practice on the right to disconnect from work outside normal working hours. And as promised, the code of practice came into effect on the 1st of April. The code aims to encourage employers to create a culture of good work-life balance and to break bad habits whereby people feel obliged to respond to messages outside of work hours. Crucially, the code refers to a right to maintain clear boundaries between work and leisure time. So the code defines the right to disconnect as having three main terms. Firstly, a right not to work routinely outside normal working hours, a right not to be penalised for refusing to work outside normal working hours, and a duty to respect another employee's right to disconnect. Now, what I just want to note as well, that in Ireland, code of practices, and there are many, we've recently had another one rolled out in terms of code of practice for bullying, but code of practices in Ireland, they're not legally binding. So this is not a new law for employers, but they can be used in evidence against employers in claims of breach of employment rights. So it is really highly recommended that employers actively look to follow these codes and to be able to show that you were abiding by them. And I suppose the easiest way and the kind of the foremost way is to have a policy, so a right to disconnect policy. But just to go on from there in establishing right to disconnect in your own workplace, and I think the code does this very well because it recognizes that each workplace is different and every employment is going to be different, and different considerations do need to be taken into account. So it's not the code to disconnect is not an automatic right to totally disconnect outside office hours. So each employer needs to take into consideration the service that you provide, what you need to provide to your customers, your clients. You might need to take into account your employees, their own contracts of employment. So there's a range of different things. So it's not an automatic right to disconnect. There are also obligations for employees, and I'll pass you back to Jennifer, who's going to go through them.
Thank you, Laura. So the code also highlights that employees have a responsibility too. It doesn't solely lie with the employer. So an employee has an obligation to ensure that they manage their own working time, that they cooperate with their employer to take care of their own health and safety, which is obviously vitally important, cooperate with any systems used to record working time when working remotely, and also be mindful of their colleagues' right to disconnect as well, not just your own. They should also notify their employer of any rest breaks that they couldn't take and be conscious of their working patterns. So I think it's right to say that there is a real fairness to this code. So to summarize, it's not an absolute right to disconnect. The code recognizes that there may be occasional legitimate situations where business and operational reasons require contact outside normal working hours. So it is important that you communicate that to an employee as well if they are required to be in contact with you outside of working hours. So implementing a right to disconnect policy, it will set a good grounding for an organizational culture in which the line between work and leisure is both visibly, respected and taken seriously. So, however, employees should take comfort from the fact that flexibility on both sides is recognised as a requirement for a workable policy in this space. And actually, for those of you who are using our Bright Contracts package, Bright Contracts has been updated to include a right to disconnect policy, which can be found under the Terms and Conditions tab. So if you have the software, it's definitely worth having a look over the disconnect policy. So the right to disconnect, it falls under the government's National Remote Work Strategy, which again has the main objective of ensuring that remote working is a permanent feature in the Irish workplace. And other commitments in the strategy include the right to request remote working. As Taoiseach Leo Varadkar said, he wants remote working to be a part of a whole new world of work after the COVID-19 pandemic, because as we've seen in 2020, this really actually is a viable option, which I suppose we never thought it would be before. So currently in Ireland, all employees can request the right to remote work from their employers, but there's actually no legal framework around it. So introducing legislation on this topic will provide employees a framework around which such a request could be based. And equally, it could provide clarity to employers on best practice on dealing with such requests. So we do expect to see further developments in this area around the autumn time. So as our customers look to bring their staff back to work, we have received an abundance of questions on the return to work safely protocol, and also questions on the practicalities of bringing staff back into the workplace. As you know, some staff will not have worked yet in 2021. They're at home, perhaps in a very small bubble. So it is probably a fair assumption to say that there will be some anxiety from staff in relation to returning to the workplace, understandably. So it is important for employers to take some time to consider how best to manage the process of returning their employees to work. So to give you an example, I have a sample question here of what a customer might ask. So a staff member is refusing to come back to work. What do I do? So the first thing I would ask here is, what are the individual's reasons for not wanting to return to work? And some of the two main ones may be, do they have health and safety concerns? Because as we know, people have been safe at home for a long time now, and there is an understandable anxiety among some people about going back into the workplace. So if this is the reason, you need to show the employee how you've met the requirements of the protocol and how you're also taking preventative measures in the workplace. So for example, if you have some employees coming back, you might have a rota for what days people come in, who can use the kitchen at certain times, and also maintaining social distancing and encouraging people to wash their hands still and wear masks. So as an employer, you have a duty to ensure that employee safety, health and welfare is important. So you are taking the right measures and then be able to put your employees' minds at ease by letting them know what you have in place. So the return to work protocol, it promotes communication and collaboration between employers and employees. So employers, need to be able to show employees the preventative measures they've taken. So you could even perhaps detail the risk assessments that you have completed as well. If there is a particular employee with specific health concerns, you will need to take into account their specific risk factors, which you may consult with the employee themselves on. And then lastly, another question may be, are they afraid to travel on public transport? So here you need to be open to suggestions as much as possible. For example, staggering work times in order for them to avoid peak transport times, which, as we know, usually means that public transport is packed. So if they want to avoid that, you need to be as open to suggestions as possible from the employee around this.
Thanks very much, Jennifer. Just come in with a few more questions and give Jennifer a chance to catch her breath. Some of the other questions that we get in, do I need to reissue contracts of employment for staff when they return from layoff? So simply no, you don't need to. An employee's contract of employment is not broken when they are placed on layoff. Their service remains. So assuming that they are returning to work on the same terms and conditions as when they left, then it will not be necessary to reissue the contract. Now, sometimes their terms and conditions will be slightly different, and particularly we get asked in relation to an employee who may be coming back to hybrid working. So, some days in the office or in the work location and some days at home. And do you need to reissue a contract in that situation? My advice here would be yes. I think it would be best practice to reissue a contract or at least an amendment to the contract. A person's place of work is considered a basic term of a contract of employment. So if the place of work is changing, then that needs to be addressed. And if you are agreeing, for example, 2 days at home and 3 days in the office, I think, again, it's best to put that in writing to avoid any confusions or misinterpretations down the line. You have it clearly in black and white what the agreement is. And just if you are going down that route of hybrid working and changing wording in contracts, I would also say that it's really important to put in a flexibility line just to give yourself as an employer a bit of scope that, it may change down the future. So some sort of a flexibility clause in that clause would be recommended. Can I take an employee back on reduced or different hours? Again, as we return, hopefully soon enough to reopening and businesses are reopening due to social distancing necessities and our new norms, I think it will be likely that this will become common practice. And it is permissible to bring people back. But again, it is a change to their terms and conditions of employment. So, you would need to get agreement from that. But I think any reasonable employee, when they see the situation and you've outlined that and you communicate it well to them, it should, I would hope for a positive outcome and people will kind of agree to that. Then the last question I have here, can I return some employees from layoff and not others? Again, similar to the previous question, I think, this type of scenario is going to become more and more common over the next few months as we reopen fully. And yes, certainly some people you can bring them back before others. And I guess to just be aware and assure yourself that when you're choosing an employee that you're using reasonable selection methods and you're avoiding any discrimination. So you're making decisions based on what's right for the business. And just once you can kind of back that up and you're confident in your decision making. So from there, I know Jennifer touched on earlier the return to work safely protocol. So we just want to go into that in a bit more detail now for you. The protocol was originally published last May, and it was then revised and reissued in November 2020, just to include the new learnings that we had on COVID in the workplace. So the protocol overall, it sets out a number of measures in order to help prevent the spread of COVID-19 in the workplace. The HSA, the Health Service Authority, they are responsible for the compliance. And since the protocol has been out since last year, overall it has been reported through workplace inspections that there has been a high level of compliance. But of late, there have been some concerns by public health around some workplace social contacts. And it seems that maybe when employees are in the workplace for maybe a little while, that they let their guard down and they tend to drop their guard a little bit. Specifically, the HSA have specifically said they've dropped their guard around wearing masks, maintaining physical distance, hand hygiene, cleaning commonly touched areas, signage, and gathering at lunch breaks. They're key areas that the HSA are honing in on, I suppose, in employment situations. So the HSA have advised that employers review their work safely protocol to ensure that they are fully adhering to the recommendations, and they're encouraging employers, particularly, as I say, as we're kind of reopening again, to re-engage with your staff, review your policies, and remind people and just ensure that you're keeping up to date and that you haven't let your guard down in your workplace. So in terms of what is in the return to work safely protocol, we kind of have broken it down into 7 key considerations. We're going to go into each consideration in more detail, but just to go through them really quickly, it is to have a lead worker representative, to review your risk assessments and your health and safety policies if necessary, to develop a COVID-19 response plan, to complete pre-return to work forms, to provide all your staff with COVID-19 induction training, to keep a log of your contact groups, and you may also then need to review other company policies as you go. So firstly then, I just want to look at the lead worker representative. Each workplace must appoint at least one lead worker representative who, along with your management, will have responsibility for ensuring that COVID-19 preventative measures are being adhered to. And similar to what Jennifer was just saying earlier there, the protocol very much promotes collaboration between employers and employees. So having a lead representative is that go-between in between your management and employees, and just helping, making sure that everybody everybody is working off the same page. In terms of getting your lead worker representative up to speed, they should attend a training. And I'd refer you here to a little training module that the HSA have on their website. It takes 20 minutes. It's really fantastic. We've used it here. We've put a link. We've used it in our own company in Source for our lead worker representatives, but it brings your worker representative up to speed on everything they need to know.
And sorry, Laura, just to say, I know people might be worried about not getting to take down the link there, but we will also include it in the follow-up email. So don't worry about taking it down here. We'll have the link in the email for you so you can have a look at it yourself.
Brilliant. Perfect. Okay, so next step briefly then is to review your risk assessments. You just want to pinpoint how and where the virus could be transmitted in your workplace, look at how hazards, evaluate the risk, and make sure you have the necessary control measures in place. And then if you've made a change to the way in which work is done, then in that situation, you'll need to look at your health and safety policies.
So the next mandatory point is that all workplaces must develop a COVID-19 response plan. And this is best thought of as a comprehensive catch-all document that deals with all points of relevance relating to COVID-19 and your workplace. The protocol specifically sets out the information you must include in your response plan. So for example, this will include stating how you deal with a suspected case of COVID-19 in your workplace. So you should appoint one employee with responsibility for dealing with suspected cases, and you must have a designated isolation area to accommodate someone who may have contracted the virus. So that's vitally important as well, as you need to have a sterile environment where the employee can go if they are unable to go home straight away, which may be the case for some people. And secondly, you'll need to reference cleaning and hygiene. So state how frequently your common areas and frequently touched surfaces are being cleaned. Have you provided sufficient hand washing and sanitization facilities, all that type of thing. And it probably wouldn't do any harm that if you do have a cleaner who comes to your building, that they perhaps have this this sheet where they check off where they have cleaned, and it's there for employees to see, because I think it's reassuring for employees to see how often areas are being cleaned and whether it's 2-3 times a day, but also just so that they know that the work environment they're coming into has been deep cleaned and it is safe for them to come into. So next, you must reference the measures you've taken to ensure physical distancing. And then you need to commit to keeping staff informed and up to date on what is happening in your workplace, but also on the public health advice as well. But the employees, they have a responsibility as well, where they need to make sure that they're keeping up to date themselves with public health advice and that they're abiding by the preventative measures that are being put in place. So it is important to include this in the response plan. And then finally, mental health. So mental health is specifically referenced in the protocol. So you will need to reference and discuss how you're supporting your employees, because it is a really tough time for people at the moment, and mental health cases have risen, understandably. So you need to show how you're supporting your employees who may be struggling, whether it's through your EAP program, or the HSA has actually provided helpful sources themselves on their website, which you should inform your employees that are there available to them as well. For those of you who are using our Bright Contracts package, Bright Contracts has been updated with a template for a COVID-19 response plan, which can be found in the optional sections tab of the software. And just so you know that it does cover everything that I have referenced now and more, and our COVID-19 response plan, it has been written closely following the HSA guidelines and checklists. So we would certainly advise that you review the policy and adapt it to include what is relevant in your organisation itself. So it is a fantastic blueprint to ensure you're addressing all the points necessary. Step 4 then is to complete pre-return to work forms. So these must be completed by employees at least 3 days before their return to work. So the form allows employees to self-certify that they don't have COVID-19 symptoms or have not been in close contact with any confirmed or suspected cases over the last 14 days. And you can actually get a return to work form template directly from the HSA website. And in communicating with your employees about the return to work, it would also be advisable to establish whether or not they might be considered a vulnerable worker. And the HSE webpage sets out who falls into these high-risk groups. So you might want to consider sending this to your employees and asking them to notify you if they do fall into any of these categories, because if they do, you do have a duty of care to take extra precautions to protect those individuals. So please ensure that you don't miss that vital step.
Okay, so I'll just come back in and take on the 5th point, which is providing staff with induction training and COVID induction training. So this will include general public health guidance on COVID and also specific information in relation to your workplaces. I'm going to go back to the HSA again, because similar to the lead worker representative training, there is HSA online COVID induction training, and employees can complete this on their phones, again, on their computers or their phones. It takes 20 minutes, and once completed, employees actually receive a certificate which they can pass on to the employer, and you can place it on their file. I think it's a fantastic way to show compliance for an employer and to track that you're kind of taking a stance on educating your employees. So I really strongly advise all employers to do it. I know we're talking about the HSA a lot, but they have put a lot of resources and time into creating these resources, and they're well worth using. But in addition then to the HSA training, we'd recommend you do a brief recap to employees when they come back, and then maybe, regularly in the workplace, just on the precautions and measures that you've taken in your workplace, whether they be one-way systems, maximum capacities in your canteens and kitchens, whatever they are, just to make sure everybody is aware. And the next step then is keeping a close log of your work groups, your close contacts. The purpose being to facilitate contact tracing should it be required. It doesn't need to be anything complicated. A log, an Excel spreadsheet, a little diary book, anything like that is perfect. And then finally, when you've done all of the above, you may want to look at reviewing and updating some of your existing policies. Previously, you may have updated your sick leave policy to reflect COVID-19 illnesses and absences. You might now also want to consider putting in place a working from home policy if that's going to be the norm in your company, or even a hybrid norm, I suppose. And again, we've got those policies updated in the Bright Contract software for you if you want them. So as I previously mentioned, then just to kind of recap, the HSA are applying a renewed energy into workplace compliance. So it is important that employers recheck and reevaluate where you are. Don't let complacency set in, I suppose. Just make sure, have things become complacent, and do you need to update and remind people? But hopefully, if you've put many of the steps in place last summer, it's really just take stock really and review, and it shouldn't take too long at all.
Thank you, Laura. So Laura has covered what was essentially the new version of the Return to Work Safely protocol, which was issued in November 2020, but it has actually just been updated again this month, so May 2021, to include new learnings on COVID in the workplace. So this update incorporates the current advice on the public health measures needed to reduce the spread of COVID-19, but it also provides further guidance for employers in relation to ventilation as part of the range of measures to prevent the spread of COVID-19, as well as information on how to approach the use of antigen testing in the workplace. So the updated protocol, it's very detailed in relation to the introduction of antigen diagnostic tests and rapid antigen diagnostic tests. So firstly, let's discuss what exactly is antigen testing. The COVID-19 antigen test, it uses a swab to take a sample from your nose, and this sample doesn't actually need to go to the lab, so the test results are quicker than the COVID-19 PCR test, but it does have some limitations. With the update to the protocol, employers must consult with workers and representatives, and also the lead worker representatives they appointed and the safety representatives, before any testing regime is introduced in the workplace. And they must also establish a process for workers who do not wish to take part in such testing, as this most likely will occur in some businesses. So it is vital that you have a process for this that is agreed. Then the updated protocol also sets out that a written occupational health and safety risk assessment needs to be done in order to take account for this new work activity, and also to detail the specific risks associated with the use of rapid antigen diagnostic testing in the workplace should also be included within that risk assessment. The spread of the virus, it is most likely when infected people are in close contact. So the risk of getting COVID-19 is higher in crowded and poorly ventilated spaces. So this can happen where infected people spend long periods of time together in close proximity, which is why it's so important to maximize ventilation in areas where people are in close contact. Just to give a brief overview in relation to what ventilation is and what it means, it refers to the movement of outdoor air into a building and the circulation of that air within the building or room while removing stale air to improve the air quality. And this can actually be achieved really easily, so either through natural means, for example, opening a window, or by mechanical means through using a HVAC system, which is a heating, ventilation, and air conditioning system. As we begin to reoccupy workplaces, in most cases, it's not required for new ventilation systems to be installed, but there does need to be improvements to current ventilation systems in order to help increase the quality of clean air and also to reduce the risk of exposure to airborne concentrations of the virus. So while ventilation reduces the amount of virus in the air and the aerosol risk, it will have minimal impact on contact transmission. So for example, touching surfaces or droplet transmission when people are within 2 meters of each other. Droplets containing the virus will settle onto the surrounding surfaces within seconds, and smaller particles can stay suspended for longer, which is why ventilation isn't a standalone measure, and continued adherence to other public health advice is absolutely essential. Employers can also seek to reduce the risk of transmission by limiting the numbers of workers in a given area and paying particular attention to work activities that increase deeper breathing. Determining ventilation of enclosed workplace settings should be considered as part of the workplace risk assessment. So it should consider some of the following questions. So for example, how do you currently provide ventilation, which is fresh air, into your workplace? How many workers occupy or use the area or areas? How much time do workers spend in this area or areas? Are there any features in the workplace which might affect ventilation? And does the workplace have multiple or complex ventilation systems in place? Now, this is just a quick overview of some of the questions that should be included in the risk assessment. There is a more extensive list in the work safety protocol itself, which is available on gov.ie. Now, it is advised to speak to the building engineer or system manufacturer before implementing any of these changes relating to mechanical ventilation, so please be aware of that. There is further information on ventilation available at the Health Protection Surveillance Service, so the HPSC, and also the World Health Organization, the WHO. And next we'll move on to the vaccine policy, which is such a topical area and again one that is changing by the day. So we thought we'd approach this section as a Q&A which covers all questions that you may have about the policy. So the first question is, can you insist that an employee be tested? So in the absence of a legal requirement for employees to take a test, no individual can actually lawfully be forced to take one, as such an action can be considered assault given the physical element of taking a test. So employees who have no symptoms should only be asked to take a test on a voluntary basis. And employees who have no symptoms or are not a close contact of a confirmed COVID-19 case, they may query the legal basis of being required to take a COVID test before entering the workplace. So in this scenario, the purpose of the test should be explained to the employee clearly. And if the employee continues to refuse the test, then employers need to tread very carefully to avoid employee relations issues here. So then moving on to question 2, can you ask an employee if they have been vaccinated? So while employees aren't obliged to provide personal medical information, employers may seek vaccination information on the foundation that they're meeting their legal obligations under the Safety, Health and Welfare at Work Acts. So it will really be up to the employee if they wish to volunteer this information to their employer. And if they do volunteer this information, then employers should not disclose this information to their employees because medical data is considered as a special category of personal data, and additional data protection regulations apply and must be considered here. And then lastly, can you insist that an employee be vaccinated? So currently vaccinations, they are recommended by Irish authorities, but they aren't compulsory for any Irish citizens. So even with the rollout of the COVID vaccination amongst medical workers, who are obviously employees of the HSE, for those employees, the vaccine actually wasn't mandatory. So with this in mind, it is likely to be very difficult for an employer to argue and even defend a case that vaccination is compulsory in a workplace. So really there is little an employer can do if their employee refuses to get the vaccine. However, it is important to understand their concern and find solutions that meet the business needs, but without infringing on that employee's rights, which is really crucial in managing their integration into the workplace. So employers need to think carefully about any action they take and also consider the potential legal consequences associated with these actions. So then you might ask, what can the employer do? So employers can promote that their employees take a vaccine, and the best way to take a proactive stance here is to roll out a vaccine policy. So we would advise doing this now to help prepare employees before they come back into the workplace. And in creating a vaccine policy, you want to consider some points. So providing your workforce with a list of resources where they can obtain further information about the vaccination programme. So for example, gov.ie or hse.ie, who are reputable sources. So your policy must recognise that the decision to avail of the vaccine is the individual's choice. However, the employer can encourage their workforce to make an informed decision, and they can do this by encouraging them to read information about COVID-19 vaccinations from the official sources, listening to information the HSE provides when offering a vaccine, but also being cautious of misinformation around COVID-19 vaccinations from unreliable sources, which unfortunately is a thing. And so just really ensure that they look at the official sources. Then you must also detail whether your employees will be paid or unpaid for the leave to attend their appointment. And if an employee feels unwell after they've received their vaccination, that they will be instructed to follow the company's sick leave policy. And we actually recommend that employers include a section in the vaccine policy about employees respecting others' privacy and not having open discussions about the vaccine with colleagues. As you know, everyone has differing opinions about the vaccine. Some people may not want to get the vaccine due to religious reasons. There are a number of reasons. So in order to respect other people's privacy, we just recommend that you just have that section in your vaccine policy just about your employees respecting others' privacy and not having open discussions. And we have just recently updated our Bright Contract software to include a vaccine policy, which covers those consideration points that I just went through for our customers to include in their employee handbooks. So this can now be found under the terms and conditions tab, along with the previous policies that I mentioned.
Brilliant. So that brings us to a close of the presentation side of this morning's webinar. I hope you found it somewhat useful. I see there's a few questions coming in, so we're looking forward to getting to the Q&A. But just to say to everybody that we have covered a range of topics today, so we will send out an email later, including a copy of the slides and a link to today's recording. Also, just to say that for any of you who are interested in seeing a Bright Contracts demo, just to take kind of a deeper look into the software, we have a short questionnaire at the end of the webinar, and you can express your interest there, and also any interest you might have in our newsletter, which holds all our information on updates that we regularly put out, and any topical legislative changes which are frequent at the moment, so you can sign up to that there. So I think that will bring us on to our Q&A. I don't know, Jennifer, do you want to kick off? Or I see a few coming in. Bear with us now till we get ourselves sorted.
Yeah, Laura, so I see a question that has come in here about what if an employee is not ill, vulnerable, or in any special category, or citing any particular serious dangers, but is unwilling to come to work even though they cannot work from home. So with this here, you could potentially take disciplinary action against such employees where you're confident that you are taking all reasonable practical steps to control the risks of transmission. But there are, however, risks involved in taking this approach, especially given that we lack any case law indicating how the courts or the WRC will approach the fairness of such dismissals. So any dismissal could be regarded by the WRC as unfair and disproportionate in the current situation. So any disciplinary action could result in constructive unfair dismissal claims, which you must be aware of. So in saying that, a more cautious approach would really be to offer unpaid leave to employees who are not able or ready or willing to return to work, as they're not really entitled to pay. So while seeking to reassure employees that you are complying with the workplace safety guidance, offering support with mental health and well-being and encouraging them to continue coming to the workplace is advisable.
Yeah, just to come in actually there, Jennifer, just when you're saying that we haven't seen many WRC cases, and we haven't, they're only starting to trickle through now, and I expect over the next few months we see more. I've seen two come in. One that's been highly in the news, you may or may not be aware of it. The case where it was a worker, she was an office admin worker in a college, and she requested to work from home, and she was refused. And the other one was an unfair selection for redundancy case due to the COVID situation. But in both cases, the WRC found in favour of the employee, and I think that's just indicative of where the WRC's mindset is at the moment. They're very much on COVID-related cases. They want to see employers doing absolutely everything to support employees. And actually, I wrote it down as a quote, and I just wanted to call it out because it was what the adjudicating officer said on that redundancy case. But they said the COVID-19 pandemic did not absolve employers from adhering to its employment law obligations. So I think that's just reflective, again, as the mindset that the WRC is at, and they're really going to want to see employers doing everything they can to help employees. But I'll just move on because we've gone on that question a lot. But I just see another question in: are employees obliged to sign a new contract? So if you are issuing a new contract of employment, it goes for all situations where you're issuing a new contract of employment. The employer is obliged to give it and sign it, but there is no obligation in any contract of employment that the employee should sign. Now, it's absolutely best practice that you would get the employee to sign, and you would certainly look to have a paper trail of conversations where you dealt with any issues, but they are not obliged to sign, the employee.
And just another great question that has come in there, especially with employees coming back into the workplaces. We don't need or can't accommodate all of our employees. So how do we choose which employees should come back to work? So we would advise that you start by exploring who would be willing to come to work. So if too many employees volunteer, you may actually need to implement a rota system or make selections on an objective basis. So if you are implementing a rota system, try to match employees with the same team each time they come into work, and split employees into smaller contained teams if possible.
Perfect. There's one here, and I probably can't answer it fully. What is the redundancy situation regarding shorter working hours? So I'm not entirely sure, sorry, what you mean by the question, but if I'm correct in thinking, is the question, can an employee request to be made redundant because they've been put on shorter working hours? So that's the same as the layoff rule, where we had that emergency measure in the public interest that came in. It came in last March, I think, but it removed the right for an employee to claim redundancy if they had been placed on layoff or short term. Previously, there was that allowance. So that's in place till the 30th of June. So if an employee has been placed on shorter working hours, they can't at the moment request to be made redundant.
Thanks, Laura. I just see a few questions coming in there just asking how much the Bright Contract software is. So there are actually two licenses available with Bright Contract. So to go through what they are, there's a standard license, which is for a single employer who creates contracts for their own business, or there's a bureau license. So you may be a company who creates contract for a number of other companies. So for the standard license, the price is €149 excluding VAT, and a bureau license is €299 excluding VAT. So both licenses, they are 12-month subscriptions. So whenever you activate your license, you have 12 months from that date. And with both licenses, there is free phone and email support included with those licenses as well.
Okay, I see another one coming in. This is a long one and a complicated one, and I feel for this person. So we'll give it a go. We have a part-time staff member who is refusing to accept hours offered as he's getting paid more on PUP. He wants to remain an employee, but is not willing to come back until we are busier and can offer him more hours. We need the 2 shifts a week that he is covering. Do we have grounds to let him go and employ someone else? Yeah, this is a complicated situation, I suppose, and I'm very cognizant of the fact that the answer that we just gave at the start, and when we were talking about redundancies and letting people go, and the mindset that the WRC is in at the moment, and I think you're particularly in that field because of the reduced hours that you're offering. If they weren't reduced hours, and we look at the PUP, take the PUP into consideration, the PUP is being offered for those people and employees who have been laid off where there is no work available. So where work is available, then the employee does not have an automatic entitlement to PUP. And this came up on some of our other kind of payroll webinars as well. And it was an issue for the social welfare, and social welfare actually set up an email address. I don't have it to hand, but there was an email address that employers could email to notify social welfare that, you know, we want Joe Blogs to come back to work. We have work for Joe Blogs, but they don't want to come back. And that would mean then that the employee wasn't entitled to PUP, so they were forgoing that right. Whether or not they'd forgo that right in this situation where you are offering them work, but maybe not to the same extent as what their normal hours were, I'm not sure. Could you let them go? I think you'd have to consider, again, taking into account where the WRC mindset is at. I'd be asking questions to myself, well, how long before you can offer him his full hours? If you don't know, if that's, you know, an extended period of time, well, then maybe I'm looking towards, yes, okay, maybe you can dismiss or terminate or make redundant because it's a reduction in hours. But if you're thinking, oh, that's probably next month or a shorter time frame, well, then I'd be a lot more fearful of letting him go. So I think as we said earlier, take a soft approach, try and communicate what are the facts of the situation, and hopefully through some sort of communication and consultation you can make an agreement.
And just another question has come in there. Are expectant mothers on the vulnerable list for requesting to work from home? So on the HSE website, they have actually noted that the information that they have so far shows that pregnant women and babies are not at a high risk of serious illness if they get COVID-19. But as we know, sometimes people are ill throughout their pregnancies, etc. So what I would recommend there is that you speak to that employee and find out what their health is at the moment, if what their fears are about coming back into the workplace. And as we previously mentioned, it's just really having that open communication with that employee to see what the reasons are, what the anxiety is of coming, because I know that even myself, my sister, when she was pregnant, she worked from home just to be certain to keep safe. So what I'd recommend there is just have that open conversation with expectant mothers and try and come to an alternative working arrangement there.
Perfect. Yeah, I'd always err on the side of caution for that one. Quick one, if you're taking an employee back on reduced hours, do you need to reissue the contract? I'd reissue something. I'd definitely put an amendment. I'd put it in black and white. I'd put it in writing. This is what the agreement is. You might not want to reissue the whole contract, but of course, if you're using bright contracts, that's as easy to do. But certainly, I'd put something in writing. Yes.
And another one there is, what do I do if a vaccinated employee refuses to wear a face covering in meetings or social distance? So obviously vaccinated individuals, they do still need to wear masks and practice physical distancing, because as we know, we need to wait until a large proportion of the population is vaccinated and that we're sure that the vaccine provides long-term protection. So it will obviously take time for everyone in our society to get vaccinated, and vaccinated people, while they are protected against severe symptoms, they could still transmit infection to others. So it's vital that they bear that in mind.
Perfect. Another long question, so bear with me, and probably another mouthful of an answer. To apologise. Given the confidentiality of payroll, can the employer use that as the basis for insisting that the employee works in the office? While now we're in the lockdown, it's reasonably safe to process payroll at home from a GDPR and privacy aspect. But when the country opens up, this may not be the case, and we need to ensure we protect confidentiality in payroll processing. Yeah, I don't really see. I think that's fine. Obviously, the person, we're in lockdown level 5. If people can, we have to follow public health guidance, and if people can do their work at home at the moment, they should. But once we come out of lockdown level 5 and whatever that next level is, and public guidance is, you can start requesting people to come back to work. So if you're making that request in line with public health guidance at the moment, I think that should be a reasonable request from an employer, and employers are permitted to make reasonable requests from their employees. So maybe that employee, maybe you come to an arrangement at the time, and you say, when you're doing payroll on those particular days, you come in, and on other days you work from home, and it's a hybrid. But I think it would be a fair request to ask somebody to come in when the time is right to do payroll. Just as an aside, from my own personal story, I was at the start of lockdown last year when it was all level 5 restrictions, and I was going into our office to do our payroll, and I got stopped at the checkpoint, and all I had to say was payroll, and they said wave me on and let me go. So the guards don't mind, and they'll let you go for doing payroll. So I think it absolutely would be a reasonable request.
And just a question in there from someone. I'm a Thesaurus payroll user, which is our sister product. Can I transfer data from my payroll software to Bright Contracts? So the really great thing about Bright Contracts is that it actually talks to Thesaurus Payroll Manager. So you can import your data from Thesaurus across to Bright Contracts. Which we have a Bright Contracts YouTube, which we have a demo on how you can do this, and I'll actually include a link to it in the follow-up email as well, so you can see how that is done. And you could also, if you'd like to, you can sign up where every week we will be uploading demo videos just on how to do small different bits of the software as well. So there is a subscribe button as well that you could do that as well. So I hope that answers your question.
Perfect. Jennifer, I'm just looking there. I think we've answered most questions, maybe a couple that we might have been repeats, but I think we've done most. So I think with that in mind, we might call it a day and leave it for today. So I'd just like to take the opportunity again to thank you all for giving us the time this morning. I hope you've taken something from this morning. I hope it's been somewhat informative. And as always, if you had time to fill out the questionnaire, if you have any interest in a demo or a newsletter, that would be fantastic too. So thank you very much, and hopefully we'll talk to you again soon.